What is ERA? ERA is otherwise called Endometrial Receptivity Assay. So sometimes we are faced in various situations in IVF where we have done multiple embryo transfers, where we've transferred very good embryos to the couple, where there has been no diagnosed egg factor or there's no diagnosed sperm factor that is a possible cause for infertility. We've done IVF for the couple, we've got very good quality eggs, we've got very good quality sperm, and it's formed a very good embryo which has either gone till day 3 or day 5. But we have repeatedly transferred these embryos to the endometrium after doing an endometrial preparation, but we have faced with a negative outcome. So in these sort of situations where we do not know the exact reason why the couple has not conceived, sometimes we may be missing something in the endometrium where we are missing something called a period of implantation. So for every woman there is a period of implantation called the implantation window. During this period of time where the endometrium is most receptive to an embryo implanting and growing. So an endometrial receptivity assay helps us to analyze this period, this window of implantation, and thereby may help in the successful pregnancy outcome. So how do we check this endometrial receptivity assay? How do we check this? So what we do is we prepare a woman like how we would normally prepare a transfer cycle. So either it can be a natural cycle or a modified natural cycle where we give medications, oral ovulogens for the folliculogenesis to happen, and then based on the endometrium growth and the follicle growth, we then normally in a day where we would have done the embryo transfer, we instead do an endometrial biopsy, and then we send that biopsy sample for this receptivity assay. In a HRT cycle where we give tablets for specifically estrogen for the endometrium to grow, we give it for a period of 12 days. We call the woman back on the 12th day, check her endometrial thickness, and then based on that we plan, if we are doing a day 5 transfer, we do estrogen, we start her on progesterone as well, and then we do in plus 7 days of progesterone, we plan a endometrial biopsy, and with this report we are able to identify that period of implantation, and then we are also able to identify whether in the previous cycles we've done the transfer too early or we've delayed it. So it tells us that period of implantation, and then we are able to transfer the embryo accordingly in a subsequent cycle based on the report.